You know the movie Minority Report, where they can see into the future. They can see, you're probably going to have this crime happen. We've got to arrest you now because you might have this happen then. Imagine if you could do that for your health. Imagine if rather than having to go to the
Mm.
end of some major serious issue, you could catch it way beforehand and put a stop to it. Well, our next guest has the technology to help do just that.
He certainly does. He is our friend, Dr. John Pierce. He's the medical director at Preventative Diagnostic Center right here in the Valley. And we're so glad to have him back on the show. Hello, doctor.
Hello, how are you two today?
Very well.
Hey, we're good. Let's start off by talking about this technology. It is very impressive. I know that the technology you have, there's not another one like it between here and Northern California.
That's correct. Yeah, so we have this Siemens Somatom Go All Pro CT scanner. It's very unique. It kind of doses it evaluates each individual patient and gives them the minimal effective dose of radiation. So we're not just kind of using a cookie cutter approach. And with that, we're able to get very, very detailed images, literally down to the size of a grain of rice, 1 millimeter. So if we see anything abnormal, we can start making some recommendations based off of what we find.
Yeah, sometimes, you want to be able to take a look at a certain thing. You might have to go to a specialist and they can focus on that one area. Sometimes they might even have to cut you open to look at that area. In this case, you're getting to see like a whole slew of different parts of the body really quickly and in zero downtime for you whatsoever.
Yeah, I mean, we're able to basically scan from just below the neck. So we're getting the thyroid, if there's any abnormalities in the thyroid, straight on down to the groin. So we can see the heart, we can see the vessels in the heart, if there's any plaque, calcifications there, see the lung, any nodules or scar tissues in the lung, any abnormalities in the lung. We can see not only the aorta and its branches off of there. So we see if there's plaques there. We can see a pancreas, the liver, any tumors, any growths in the liver, down to the ovaries in women, the uterus, the prostate in men. I've gotten reports where we can see enlarged prostates. Wow. We can also see aspects of the bowel. So it's really inclusive. When I get a full body report, I can tell you pretty much if all systems are clean or there's any little abnormalities, right? And when sometimes there's little abnormalities that are not concerning, and other times there are things that, hey, this is a little concerning. We need follow-up testing, or we need you to follow up with your primary care doc or a specialist, because this really needs to get looked at sooner rather than later so we can have that absolute preventative approach.
Absolutely. And I was giggling during that, doctor, because you sounded like a car mechanic, bringing in a car in for its 10-year, all systems checkup.
Full
But that's what you're doing. Yeah. You're taking a look at so many things. Doctor, there's things like heart disease and cancer that are so serious and that really, really need to be detected early. You have been able to help some people along. Tell us about some of your recent client successes.
There's one patient, we had done a scan and we found some abnormality in the lung tissue. It was called a ground glass appearance, which can be caused from many, many different reasons. So the radiologist said, hey, let's do another scan in 4 to 6 months. And we did, and we found that scan showed that the abnormality that we seen was a very aggressive form of lung cancer.
Wow.
And so she got in to see her doctor. They got her down the right channels. Now she's scheduled, and she's already had the surgery. I don't know exactly when it was, but she had that lung removed, which for her, you lost, that sucks. But she didn't succumb to lung cancer because by the time that would have presented symptoms, especially with that particular form of cancer, it's generally metastasized throughout the body, and it's too late. So it was caught early enough for her to be able to have a surgical correction to kind of minimize her risk of early death from this.
Wow. Really incredible. And JJ, I know you got a scan done. I mean, this is a relatively simple scan that can give you some pretty complicated and knowledge, give you a lot of knowledge in the inside. What was your scan like, JJ?
Yeah, thanks, Sean. Well, I basically had a scan, I believe, doctor, from my chin to my groin and everything in between. And the process was really easy. I really appreciated that I asked a lot of questions And everyone down at Preventative was super patient with me. I also was very relieved that I was not going to go inside like in a small enclosed space. You called it's kind of shaped like a donut.
Yeah.
It could not be easier. It is the simplest process. And then afterwards, you go through a few hours or a few days waiting to get those results. And if you're like me, you're a little nervous because you're imagining the worst. But in fact, they're looked at by a radiologist. And then if anything is wrong, I would have heard from you. I didn't hear from you, doctor. Kind of
just on that side of it, you're right. I didn't have to make a phone call to you. Because you're skin pristine, basically, right?
Yeah. She was incredibly clean. It was a certified pre-owned.
Thank goodness,
She was great. And worth noting, by the way, when the scan is done, we do get those results. If there's something to be seen, you'll let us know right away.
Yeah, I get those results when they're abnormal, and I personally make that phone call because I want to be able to educate the patient and make sure that they get in the right pathway towards taking care of that issue.
Awesome.
Mm-hmm.
Well, hey, it's great having you, doctor. And really quickly, we'll tell them about the special offer.
Thank you, doctor.
For a heart scan and a calcium score. I mean, this can be a lifesaver for somebody watching at home. It's great having you, doctor.
Thank you very much.
All right.
So you want me to tell them about the offer?
You can tell if you want. Go ahead.
Happy to tell them. So right now we're offering that heart and calcium score for $125. It's normally a $599 value. So because we want you to come in and at least get that score. That can be life-saving. We've got some great cases of saving some lives with that as well.
No question about it. Well,
Look at that.
It's great having you. We're going to save some people money and maybe lives as well. Great having you, doctor.
Thank you very much.
I tell you what, Dr. John Pierce, he does his own specials. He doesn't like avocado, though, Sean. So go ahead one more time.
Yeah, there we go. It's fine. For the rest of you, though, it's okay. Listen, a heart scan with calcium score, $125, normally a $599 thing. So this is a huge opportunity for you to get to the bottom of your health. If you want to learn more, the website right there on your screen. Preventative Diagnostic Center, a proud sponsor of The Morning Blend.